What up, fam? This is Dr. De Luna. You are listening to Drop It Like It's Doc podcast. Today, I am so excited to share this conversation with you that I had with Dr. Theresa. She is my favorite pelvic floor therapist. And if you are unfamiliar with pelvic floor therapy and how it can change your life, whether you have had a baby or thinking of having a baby or just have some constipation or low back pain, this is an episode you are not going to want to miss. Hi, Dr. Theresa.
Hey.
I am so happy to have you on today.
I'm so happy to be here. Thank you for having me. It's so awesome.
Of course. I mean, when I had a feel from my listeners that they wanted to learn more about pelvic floor therapy, you were, of course, the first person that came to mind. So
thank you for thinking of me. There's so many choices. I'm glad you chose me.
I mean, I chose you to be my pelvic floor therapist, so it just makes sense.
Yeah, that was our bonding moment for sure.
We've bonded before, but that was very intimate and very, very bonding.
Totally.
Yes.
Yes.
So to my beautiful friends watching who may not know this gorgeous soul, this is Dr. Theresa. She's a doctor of pelvic floor therapy. And I always start this by love bombing, by telling you exactly why I love you and why I want you on and why I want my listeners to learn from you. And I have loved you from the first time I met you. I love your smile. I love your personality. You always show up as yourself. You inspired me to be more of myself, whether you're aware of it or not. Because when I walk,
so sweet.
Truly, you really did. And it's because you always show up as yourself. You always have some kind of bling on. You're always playing around with self-expression. You make it fun. You make it playful. I mean, look at your hair. It's phenomenal.
Thank you.
You're welcome. You are the reason why I braided my hair. Some of the listeners and viewers watch that. But also just in working with you one-on-one, you are so loving and you hold such beautiful space because the work you do is very vulnerable. And it's something that I'd never had done before. And I felt so comfortable, so taken care of, so heard. And I'm sure that all of your patients feel that way.
Oh, I hope so. That's so sweet of you. Thank you so much.
You're welcome.
Amazing.
Just truth, my friend.
Well, I feel really connected to you right in the way.
Beginning.
I was like, okay, I need you as my doctor. These are my kids. Please just help me with these children. And you were just like, oh, your daughter wants me to check her more, so I'm just going to play with her hair. And I was like, what other doctor would just play with my daughter's hair while she... I was like, thank you. And my daughter was like, yeah, I got checked today by my doctor. Like, it was so sweet.
Well,
amazing.
It's always the biggest compliment when someone trusts me with their most sacred possession, which is their child.
Totally. Yeah, I agree. I wouldn't go to anyone for sure.
And plus, we're both Jewish, so we're probably related.
Yeah, true.
Yeah. The tribe.
Long lost cousins.
Exactly. I mean, don't we look identical?
Yes.
Yeah. So, my friend, obviously, I know how you practice and whatnot, and we're going to dive all into it, but I would love to hear a little bit about your story and what guided you to be in this part of medicine.
Awesome. So probably when I was in second grade-ish, maybe even before that, I was like, I want to work in healthcare. And I really am interested in physical therapy. So my littlest brother was born with Erb's palsy, the brachial plexus injury. And so he had PT like right off the bat, right after my mom had him. And I was like, that's a cool job. You know, so as going through grade school and they make you like write about what you want to do when you grow up, you're like, I'm going to be in healthcare, or I'm going to be a doctor, or I'm going to do this. And so in high school, I did a health practicum, and there was like cardiology, pharmacology, like all different things. And I was like, physical therapy, let me like check that one out too. And in that department, it was so fun. Everyone was like playing ball. They were like joking around and laughing, not to bag on any other medicine, but in the cardiology, they're like very serious and high strung. And then like the other professions were a little bit more, I don't know, checking the charts and all this, and other people in PT were like playing around. And I was like, this is so fun. I think I want to go to PT school. So basically went to college just so I could go to PT school.
Amazing.
Yeah, and that's where I am here. And then Well, orthopedics is like the bread and butter of PT, so we all know how to like rehab an ACL or a rotator cuff. But then there was like a section on pelvis, and it was women's health at the time, 12 years ago. And I was like, well, that sounds interesting. Let me check out women's health, like this section on women's health. So I took a course, and me and my best friend were sitting next to each other. We're like, let's go together so we can just be each other's lab partners. And so we went together, and of course we were each other's lab partners, and they're like, time to switch.
Yeah.
Next vagina. We're like, okay. But it was like amazing. That was like my moment of being like, whoa, this really works. Like, I haven't had kids yet, and I felt changes in my pelvic floor with like simple manipulations and like movement. And I was like, oh my gosh, there's space. Like, I feel less bloated, and oh my gosh, that brought out emotions. And it was just like the coolest experience. So definitely found my passion that way.
Incredible. And I feel like that's how so many people that are working in medicine find their little spot, is that it almost finds you, and it's what is just exciting and what lights you up. And
yeah, totally.
And it's incredible because I feel like for even a long time, while I was a doctor, I was not connected to a pelvic floor therapist. And in medical school, we didn't even necessarily talk about the benefits of it or how we could support our patients with it. And I think that there's even the misconception now that it's only for people that are pregnant or postpartum, but I'm not pregnant, I'm not postpartum, and it's helped me significantly. So
yeah,
what are some things that you like to support your patients with that are not pregnant or postpartum? What things show up in the pelvic floor?
So definitely there's some specialty pelvic floor diagnosis going on, like endometriosis or bladder pain, IC. And those really do need a pelvic floor therapist on their team. Like, they're really hypertonic. They have a lot of tightness and a lot of things going on with the pelvic floor that definitely need hands-on care. And so having that team member is like an amazing part of it. It's hard to manage it with just the mainstream like OBGYN of birth control. That's a really like ineffective way to manage endometriosis.
Yes.
You're not touching anything, like you're not manipulating anything to change that. So that's someone that definitely can use it. But then all around, like, we hold, as people with wombs, we hold so much tension in that area. That's where we like our creativity is. That's where we like store energy. So sometimes like we just need some releases there. And then pelvic floor PT could be for that too. And I'm not saying all pelvic floor PTs are like this. I've had some experiences with like very Western pelvic floor PTs that it's not their thing to do steaming, or it's not their thing to do like tuning forks or something like that. It's like a little out there for them. But just in my experience, like, we're energetic beings. There's so much energy there that's part of it.
Yeah. Beautifully said. And especially the womb. I think our whole body is this energetic battery, but the womb, just being a womb holder, there's so much there, and there's so much wisdom and so many feelings that are just fully independent of the brain or the nervous system. It just has its own energetic pod almost.
Totally. And it's like passed down from generation to generation to generation. Like, we have like our grandmother's trauma, you know? And like, shoot, they went through a lot, those grandmas of ours.
Yes, I did. Yes, they did. Yeah.
You know, like, there's a lot of energy, and we like hold that and store that. And it's good to have that, to learn from it and be part of it. But at other times, it's like, we don't need all that stress. Like, we're safe. We're okay. Let's release some of that.
Yeah.
Take it back, universe.
Yes, take it back. Process it. I am curious because this is making me think a lot of sexual dysfunction and things that could come up with, you know, having sex. And do you work with a lot of individuals who have such a significant pelvic floor that it's challenging for them to have sex? Like vaginismus, things like that?
Yeah. Well, yeah, of course. Vaginismus comes up. That's a lot of times why people find me too. Because they're like, I don't know why intercourse is just not working right now. And it's just not helpful. And there's a lot of physical attributes for it, but energetically too. You know, there's a lot of your body's responding to something. So that's a way to help process that trauma or process whatever's going on. Sometimes it's not the right partner, and they find that out, that's the cause. And then other times it's like physical. Maybe the bladder is a little bit lower and your body's just contracting around it, and that's causing some of the problem too.
And I don't have that issue, but I know that when you were feeling in my body, you told me that my bladder was lower. That was something I didn't even know, but I was peeing all the time. That's gotten significantly better since I saw you, by the way.
I'm happy to hear that.
Yeah, that's another common thing that I see often is just frequent urination.
Yeah, true. Yeah, viscerally, like we're all like housed in there, and it's all neighbors. So if something is like getting jungled around, I mean, it could fall a little bit and then cause you some issues, you know?
Yeah. And the emotional piece that you said as well, I didn't even think I was going to have an emotional release when you worked down there, because me and my womb, we're pretty close. I'm grateful that I haven't encountered any sexual trauma or anything that I'm aware of while I've had this body in this life. But who knows what that was? It could have been ancestral. It could have been the collective's trauma. It could have been shame around being a woman. It could have been all of these things that is so beautiful that you're able to help a woman feel safe and help a woman explore that. So just for my listeners that don't know, what does this type of treatment involve? What are you actually doing?
So with a gloved digit, we'll do an intervaginal exam, and that's my physical therapy point of view. I'm like looking at muscles, assessing muscles with my finger. I'm assessing the muscles, the fascia, the joints, and feeling like what's going around here. Seeing if I could assess the bladder, like I'll follow the urethra up and then see what we feel there. Sometimes like behind where the rectum is. And I'm just like assessing and getting a feel and sense like lay of the land. If there's something tight or feeling, maybe there's some tissue there, scar tissue perhaps, something going on, then I tend to like stay in that place and see if I could release that, or if I could work on it, or follow where it's getting pulled to and work that way. And then it seems that the energy just follows that, you know, like intuitively I'm like, I don't know why I feel like this side should let's stay here. And sometimes that's a reason why, like it's staying there because like energetically it needs to unwind almost, you know. But on that point of view, it's basically the body is doing it. Like I'm just there and it's kind of coaching me where to go, and just being in my like educational point of view and then energetic point of view, it just kind of helps me. But the body's like doing the hard work, right? Like it's the one that's unwinding, and it's the one that's like telling me it's tight for some reason and it needs the release. So it's pretty interesting.
It reminded me a lot of craniosacral, and I know you're trained in craniosacral and you have such a light, loving touch, but I could feel the unwinding, and that's how when I practice craniosacral, I never try to think of where I'm going. I just follow a pull, and I trust the body, and I think of it as if I'm just shining a flashlight on something that is beneath the surface. The body can see it, it releases it. That might be physically you feel it, it might be emotionally that you feel it, it might just be energetically, you're like, something shifted.
Yeah.
And I think that we don't even need to know what we're releasing as long as we let it go.
Right. Yeah, I agree. I love your craniosacral, by the way.
Thank you.
That's like my time, man. Remember when I like choked on something? I was like,
something came out of the throat.
I was like, okay, that was a great release. Then I felt like so much lighter after. That was amazing.
See, and we didn't need to know what got stuck in your throat. We just let it fly away. Yeah. It's gone. It is gone now.
Yeah, that was amazing.
Yes.
Yeah, I love your craniosacral treatments. It's the bomb.
Thank you.
Yes.
And I love everything that you offer.
Oh, thanks. Yeah, I like craniosacral too. I think it's a great way of like being light and just letting the body like unravel.
Yeah. And you know, the womb is delicate. She doesn't need force.
Agreed.
Yeah.
Yeah.
Speaking of that, I didn't know this until medical school, like many things about my body that I was just never taught, that the uterus is essentially just a floating organ.
Oh,
just floating in space.
It's just there.
Yeah.
Hanging out. Sometimes it falls.
Yeah.
From side to side.
Yeah. Can we talk a little bit about that?
Yeah.
Yeah.
I mean, it does. I mean, it can move around and fall, and then like it moves with your cycle too, and it moves in all these directions and stuff. And then sometimes it kind of like gets stuck on the side, or it's like, and you're like, why? When do I bend to my right? Am I feeling like a pinch? And like, maybe it's not the uterus. Maybe it's like pinching somewhere else, but that's the cause of it, and that's like the driver of what's going on. So helping that kind of back into position viscerally will help that pinchy feeling, and it's so interesting. And then of course like cycles change, and so you have like a big clot that month and you're releasing something like that could cause a little bit of a shift, and being pregnant or any old thing.
Yeah.
And bigger anatomies, smaller anatomies,
space,
toys.
Yeah. All sorts of stuff can move it around.
Yeah. And usually the body's pretty good at like just putting stuff back together. But then sometimes it just doesn't, and we compensate so well. So we're like, oh, it shifted, so I'm just going to shift this way. And then all of a sudden you're like, but my shoulder's feeling weird. And it's really coming from here. It's not the shoulder, right?
Yeah.
Interesting.
That also made me think of a fun just connection between the pelvic floor and the throat. Do you know much about this connection?
I mean, once I was in a SLP, a speech language pathologist office, and I was like, is that a pelvic floor picture? And she's like, no, it's the back of your mouth. And I was like, oh my gosh. The body literally didn't want to recreate something new, so it gave us a larger image right here.
Yeah.
I mean, that's amazing.
Yeah.
There was a study, I don't remember the year, but they were having people with trachs sitting up, and they're like, they cannot sit up well. So they capped them, and they're like, whoa, they could sit up so much better now. What's going on? And it was this whole breath movement with their pelvic floor that they were able to control that breath and that intra-abdominal pressure. That was something when I read, I was like, dang, the pelvic floor is like this whole body. Like, you can't just say like, I only work on the vagina, really. It's like the whole body, it just is part of it. And sometimes like it leads you there, and you're like, I gotta check this jaw tension, you know?
Yeah. I know in craniosacral, usually if I'm pulled to the throat and if there's significant tension there, I'm usually pulled to the pelvic floor too, and I release it in a very different way. I'm not going inside of someone's body. I'm just holding their pelvis and seeing what shifts. But I also release a lot of the uterine ligaments that are helping the uterus stay in center, but sometimes, like you said, it can be tilted from one side or the other. And I know for me, I didn't even know that my uterus was tilted. She's not tilted anymore because I visited you, but she was tilted in medical school. This is a hilarious story that is literally hilarious that I'm saying this on recording. But in medical school, as you know, as you just shared with your friend, we practice on each other for the most part. However, we had a practicum in which we were doing a full pelvic exam, men and women, and our female model just didn't show up that day. She just did not show up. And I don't know if you used to get anxious in medical school. Me and all my friends were so anxious waiting for this exam. We had prepped for it. We had studied and mentally prepared, and to be there and think that we weren't going to do it that day was not an option. So I volunteered. I'm like, I have a womb. Would you like to look at mine? I mean, the school had already seen everything else inside my body. All the students had, we're all going to be doctors. I didn't see a big deal about it. And quite a few students could not find my cervix. And they'd be like moving around. And they'd be like, oh, it's tilted. And it would be over to the side. So that was interesting just for me. And I'm curious, do you see a tilted womb related to things like menstrual cramps?
Oh yeah, yes, for sure. I mean, if you could like imagine that on like any part of your body, like if you're just like to the side of the right side, like your left side's just lengthened, that right side's like more crampy and close together and rubbing on each other. I mean, it's supposed to contract and dispel blood during your period. So yeah, it has a natural movement. But when it's like congested there, yeah, that's going to cause a lot of cramping. I mean, and that's when like sometimes people are like, I get a lot of diarrhea, or others are like, I'm totally constipated. Like things are getting rubbed and pulled that they're like, oh, I can't move, there's a poop stuck in me, or like just draining as much as they can because it's constantly getting rubbed, and the reflex is like, you gotta poo now, but it's like constantly coming out.
I'm happy that you brought that up, just because people, I think, aren't aware of how weird your poops can get around your period, and also just how close all of your organs are. Bladder, uterus, bowel.
Yeah, totally.
So if one's off, the other can be off. And also, thank you for helping my patient with constipation. She is doing so much better since she saw you.
Oh, nice.
Yeah.
My pleasure.
Yeah.
Yeah, I know. We're always like their neighbors, right? Like everyone's a neighbor. And like if one of the neighbors is cranky, it rubs on the other neighbor and it gets cranky and they're all like irritated.
Yeah.
So you have to like solve that cranky neighbor.
Okay. Speaking of cranky neighbors, have you ever seen that anal sex has influenced someone's womb?
I get that question every once in a while, and I feel like that is something that's quite like personal to that person. If you're in like a consensual place and you feel comfortable and you're like allowing this type of intercourse and you feel good about it, it doesn't really bother it that much. However, if you're not comfortable with it and you're like, maybe I shouldn't have done it, and then if it kind of hurt, but my partner wanted to finish or whatever the case is, it does seem to have an issue just because of the neighborhood.
Yeah.
So it does seem to bother it a bit. But then again, I'm like not one to tell someone like the way that they have sex is like not the way. However, I'm like telling them from a physical point of view. I'm like, well, everything's really tight here right now. It seems like there's a lot of inflammation, or this part of the muscle is irritated, and that could have been like rubbed by that anatomy or that toy or whatever you were using. So maybe hold off until this is healed and you feel back in that place, But that is a good question. I get that every once in a while.
Yeah.
Yeah.
And you speak to just how the muscles are tight, and really muscles tighten in anticipation to be used to protect. And I love that you brought up the safety piece, because I think that you could say that to be true of any type of sex, right? Any type of sex. If you're not feeling safe, or if you don't want to do it, or if you're doing it for the other person, that is a disservice to your body, and your body will then overpower that choice, and it will tighten to protect you for
Definitely.
better or for worse.
Like in animals, they tuck their tail. Well, we tuck our tail too.
I love that you said that. I love that you said that. And that brings up a lot for me, because I have one individual in mind that I'm thinking of, that her tailbone is out of place. And depending on where she is in her cycle, or depending on just how she's feeling, she can manipulate her tailbone and it will change her bowel movements. It will change her periods. And that actually happened after a sexual encounter that she did not want to have. So I don't know if I'm asking a question or just stating something interesting, that she was tucking her tail.
Yeah, that is interesting. I mean, tucking it in defense and scared. I mean, we can see this in animals all the time. And we're animals, right? So we're like tucking to protect, or because we're scared or self-conscious, whatever it is, it's doing it for a reason, you know? But that's something else, like we want to train the body to like, hey, we're a friend, not foe, and we're going to help release some of this, because then it gets stuck in this pattern tightness when you're like, I don't want to be stuck in this. I want to mentally be okay now. How do I train my body again? And that's where the coaching from the pelvic floor PT comes in, right? Like, I'm just the coach. I'm just here to help and tell you and show you where and how to release that. And then your body's going to process it and like let that integrate a little bit, and then be in that type of setting where you do feel safe and comfortable again. You know?
Yeah. Honoring that, honoring the autonomic nervous system. I couldn't help but think of, do you remember the movie Shallow Hal?
Yeah.
With the guy who had the tail?
Oh my gosh. Yeah.
Maybe that's why I love twerking so much.
Oh.
Yeah, because it just liberates my tail, opens up the pelvic
It probably
floor.
does liberate your tail.
It does.
Now that I think about that, that's pretty amazing.
Yeah.
That's a lot of, medicinal dancing right there.
I agree, sis. I could not agree more that it is straight medicine.
Yeah, that's amazing.
Yes. So far we've talked about people that are not pregnant or postpartum. However, I think it goes without saying that someone that has grown an incredible angel inside of their body, their whole anatomy has to shift. So much pressure from the abdomen down into the pelvis takes place. So a question that I get a lot is, doctor, am I just destined to have my organs fall out if I want to keep having more babies? How would you answer that question?
You're definitely not destined to have it. However, I mean, stretching, that's a huge stretch in a matter of 9-10 months that you're going through. And then that whole space occupying baby is released in that placenta, and then everything has to come back down. So you have a lot of space and movement, and they get in where they fit in, and landscape changes. So there's definitely more risk to having a prolapse. However, it's not necessarily true for everyone. I mean, we take a look at, like, in research, that the way that your structure of your body is, if you're like a more flexible person, you have a higher risk of having a prolapse in the future. However, that doesn't mean you're always going to have one, right? But we just want to be more aware. You know, like, oh, this is a possibility. These are some things that you could do preemptively. And then there's some people that are just like so tight and just compacted that, I mean, nothing's going to fall through that. You know?
And it's individualized, I'm sure, and it's dependent on someone's body, their hormones, their day-to-day habits. And I work a lot with yogis and people that we do a lot of pelvic floor opening in yoga, even without realizing that we're doing it. Malasa and stacking our hips and doing happy baby and floor frog. We're opening the pelvic floor.
Yeah.
So a question that I get a lot of the times too is, why am I queefing in yoga?
Oh, yeah.
I'm not queefing in yoga. I'm talking about my pregnant friends and postpartum friends. Okay.
Yeah. I mean, sometimes that happens. It's kind of like almost like a incontinence thing too, like where you might get a little leakage, but it's gas. So basically it's like incontinence back in the back door.
Yeah.
So you don't purposely want to let out gas, but it's coming out, is showing that maybe so there's two possibilities. I mean, probably it varies among everything, but in my realm, there's two possibilities of like you're over tight and you're already tight, and then when you open up, you cannot open much more and that gas is coming out. Or you're really weak and you're unable to hold that back and then the gas is coming out.
Mm-hmm. So. On a case-by-case basis, is that something that someone would know for themselves, or would it have to be through someone who is familiar touching pelvic floors, can assess the muscle tone to be like, yeah, you're actually tight, you're not loose? Because I think people probably assume that they're loose and people don't realize that they can be too tight.
Yeah, I would say, I mean, if you wanted to like enter a digit and try to do a pelvic floor contraction, like squeeze and lift and see like how much excursion you get, that could be an indicator. Like, are you getting a lengthening and a tightening, or are you just getting like a little clench? If you're getting like a smaller clench, then you're probably already upregulated, already tight. If you're getting like a long lengthening and you don't feel a clench, or you feel like barely any movement, you're probably weaker. But it is hard to self-assess. I mean, you're using your abdominals usually when you're like entering your digit. And it is, I mean, it's not like a skill we all have to check.
Yeah.
Right. So it's a little harder.
Yeah. In general, though, I work with so many individuals that are like, ooh, I'm not putting a tampon up there. That's gross. And I'm like, it's your vagina.
Oh.
What do you mean? Like you don't put your finger in there? But a lot of people don't. So I love that you said that, because we should be comfortable with our bodies. We should know what feels off when something is feeling like it has shifted or something is just not how it was the month before. So I love that you said that. And also I love that in that you can see how where your cervix is, because your cervix is moving because it's the bottom of your whole womb.
Yeah.
Moving up and down and all around.
I mean, our first like lab, I remember, like, give me your finger.
Here's my finger.
What the pelvic floor felt like to me. I was like, oh, okay.
Yeah.
Well,
yeah, my finger's just still holding here.
I was like, that's what it feels like. Interesting. Like,
yeah.
But I mean, and I was like already a trained PT, right? And then it's like, you just have to train your mind differently to like assess where and what and how it's going down. So it is harder to do being someone that just like feels that squeeze and they're like, huh,
it's
okay.
working. Yeah, totally.
Which is fine too. Like, great.
Yeah.
But it is good. If you have any questions or concerns, it's like best to do an assessment and see where you're at.
I fully agree.
Like, it's a great like baseline anyway for anyone. Like, and I was at Sharpry Steely for 7 years, and I was in the pelvic health department, and I loved it for all the patients I got to see. But they were always like something with a diagnosis. That's fine. That's how hospital setting is. But I wanted the like wellness people. I wanted like a pre-pregnant person, or I wanted someone early in pregnancy that just wanted a baseline to talk about how their muscles would perform during physiological birth. And I like wasn't getting that, because every time I was like, hey, can I like see someone preemptively? They're like, but what's the diagnosis? And I'm like, pregnant? Like, there's no diagnosis. Like, can it just be a wellness visit? And they had a really hard concept with that. So now I'm in this birth center where I could see people for like wellness stuff, and I'm like, I'd rather just do this. Like, this is cool. I get to see people anyway, no matter what.
Absolutely. And I love that you brought that up also, because I think it would be, I've never been pregnant. I can't wait until I'm pregnant, universe. But in the right time, universe, with the right person, universe, had to just clarify all of that on air. But are there certain things that you would recommend that someone does when they are preparing for pregnancy, outside of getting an assessment of their pelvic floor, things that they could do at home, or stretches, or just anything?
I mean, yeah, there's like, I love yoga. for pelvic floor. It's amazing. Pilates is another like nice exercise that does like diaphragmatic breath and pelvic floor. So, I mean, I guess all in general, the diaphragmatic breathing is always good. I'm a huge fan of steaming, as you know. I think it's always nice to like steam and connect to your cycle. So you're not pregnant now, but you're like just steaming around your cycle is like an amazing way to connect with that pelvic floor and just kind of get it ready, like a warm womb ready for the embryo to attach.
Yes. Yeah. Steaming is so nice.
Oh, it's so amazing.
And I love that you include that in your treatment.
Thank you.
Yeah. Felt like I said this to Dr. Steph next door. I'm like, I went to the vagina spa today. That's what it felt like. I went to the spa. It was so nice.
So amazing.
Yes.
No, it's nice. It's a nice way to like warm up the pelvis too before like a not pleasurable assessment. Like it's okay. For most people it doesn't hurt or anything unless they have specific pain. But to warm it up and like just give some love to the womb and you're like, all right, we're here.
Yeah. Instead of, being in an OB-GYN's office being like, all right, you're going to put on this gown, take your pants off. I'll be in a second. And it's freezing and your vagina's like, what's going in there? This cold speculum.
I know. And my knees are always turned and they're like, open your knees. I'm like,
I'm trying.
I am.
Yeah. They're open. I'm fully relaxed right now. And your inner thighs are like
your butt's all
contracting.
clenched up. They're like, can you unclench your butt? You're like, I am.
Yeah. I'm trying.
My tail's tucked.
Yeah, my tail's tucked. Okay. That's what I'm going to say now. I love it.
It's awful. It's awful.
Yeah, it is. But, there's practitioners like you that are just changing the narrative and making it so you don't have to be uncomfortable.
Oh, yeah. Yeah. People are better about that now, too, with PAPs. They're like, oh, you can steam before. Or,
yeah. Yeah, absolutely. So a question that I also get all the time is, can you over Kegel?
Oh, yes.
Mm-hmm.
You could over Kegel.
Yeah.
So I don't love the Kegel.
Ooh, tell us more.
The Kegel was first thought upon when Dr. Kegel put a pressurometer in a vagina and was like, squeeze. And then he's like, oh, the pressure, it says you're increasing pressure. So therefore, when someone squeezes, their pressure is increased and that will strengthen the muscle. So that was the one muscle, the bulbal spongiosis or the bulbal cavernosus was getting squeezed and it was increasing pressure. But in that day and age was like, I'm increasing strength. However, anything that you're just squeezing over and over again, then you get locked in that position. Like you're not necessarily strong on a flexed bicep, right? I mean, you're over squeezed and you're just doing this all the time. You're not going to be a strong person per se. You need to like lengthen and you need to be able to move and manipulate. So you could definitely over Kegel.
That's a really good way of thinking about it because if the muscle is shortened, it doesn't have the capacitance to contract and to relax. And that's what a healthy muscle is. It should not always be contracted. It should not always be relaxed.
Active insufficiency.
Yeah.
Right?
Yeah.
It's just insufficient, but it's active.
Mm-hmm.
So it doesn't make sense to be flexed like that in that position the whole time.
No, it does not.
Right. I mean, that's most often I do see people like that. So they think they're weak. They're like, I have incontinence or I feel weaker or things just don't feel right. And it's usually the active insufficiency. And it could be like years of tucking your tail and you don't even know it or a posturing thing that you don't even know you're protecting.
Yeah. I think in general, so many individuals are disconnected from their pelvis just because, I could list off a dozen reasons. We sit more than we've ever sat in our lives and the blood is just pooling in the pelvis. In general, sexuality is shame. So some people go, oh, that doesn't exist. I don't have one of those. It's just something that so many people don't drop into. And it's interesting that is the case because there's so much wisdom there. And also it is the root of so many things that I find in health.
Yeah.
Yeah.
I would say so too.
Yeah.
Even during my day, I would say I'm like seeing someone and while they're tucked, I'm like kind of tucked and I'm like, Theresa, like untuck, like, because it just like comes like energetically, like this is the way someone's presenting and I start to feel it in my body and I have to like release that too,
Yeah.
It's so weird.
Yeah.
But we're like all sisters. So it's just
I know.
Like, we like empathize with each other, There's a story and we're like, wow.
Yeah.
I'm going to protect myself because I heard your story, So I'm like, okay, got to release that. So
yeah.
Sure.
The fact that females can cycle together after being together for a short amount of time is enough to prove this interconnected sisterhood that we all have.
Wild.
Yeah, it is wild.
I love it.
I know. I love it too. I love having a womb. I love all the information that she gives me. And when she was off, it was quite clear to me, and you were the first person that I called. So grateful, because I think that when something like that happens, it's even scary to think about getting someone to assess your body. Mm-hmm. So then it's something that you could even push down deeper and hide. But then it's just going to get louder. If that imbalance is not addressed,
right,
your body will start to scream at you, like anything in the body, right? But, I think the womb is a little bit more delicate than other parts of the body.
I think so too. I agree. I mean, I have brothers, and sometimes I was like, man, I'm the only girl. Like, why is this? I wish I was born a boy, but like at this age, I'm like, no, I'm the magical one.
Mm-hmm.
Like I get to do all this stuff. I have the womb. I have like old wisdom here. It's so like my body tells me so much stuff through like period blood, like any old thing. And I'm like, this is like my special power.
It
like,
is.
I'm a superhuman,
Yes.
So
I couldn't agree more. I love being a superhuman. I really do.
You are.
Thank you. As are you, sis, which is why you're here. The sweet womb. And it's wild that I've said this on the podcast before. I don't know if it hit home for anyone, that we started inside of our grandmother's womb. And that's where a lot of that energetic trauma can take place. And I know that my grandmother was not living in a very safe environment. I know that her grandmother was absolutely not. I mean, the Holocaust is in my lineage. And then my mother, had me. And it's incredible to think that our DNA is holding some of that trauma, and that we are not destined by our genes. It's what is around our genes, epigenetics, that tells them what to turn on and off. And trauma can be part of that, but we can break that trauma in actually sitting in the womb and feeling those things and releasing it and finding that safety. And that's another reason why I love preconception care so much, because you're actually changing the life of your grandchildren.
That's so cool. Yeah. I didn't even think about it like that, but for sure you could pass that on as like a gift, right?
Mm-hmm.
Wow, amazing.
Yeah. I mean, the work that we do does change the history of
totally does.
humanity.
Now that you put that on the table, you're right. How cool.
Yes.
I love that.
So fun. Yes. So outside of the obvious things that you would think to go see a pelvic therapist for, a lot of things we talked about, what is something that might not be on the top of my head that someone would benefit from pelvic floor therapy?
Good question. I mean, I would say if you feel any sort of disconnect with your pelvic floor or with your womb, that would be something that you could see a pelvic floor PT for. Just like wellness in general, we don't really get, so like we might get massage and we might do other like wellness care, but we don't really get someone that assesses internally how everything's going on there. So just like a wellness assessment is a totally fine thing to go see a pelvic floor PT for. Sometimes when things are just not going away, like a low back pain, irritation, and you've done, all your other remedies, and it might be internal. And basically I tell people like, I'm an inside out therapist. Like I'm going to check internally and see if anything's off there and then move outward. So there is a lot to be found internally. And that could be a reason why something's just not going away, or like you've had this like a backache for 10 years or something crazy,
I'm so happy that you brought up lower back pain, because I don't get lower back pain on my period. Some people do, but people like me that don't get low back pain related to their cycle may never have considered that the same nerves that are leaving out of your lower back are also swimming and going to your womb and to your entire pelvis. So if something is off in any of those organs, or structurally limiting blood flow, or limiting the blood flow to a nerve that is going to one of those parts of your body, that it can then show up in your low back.
Yeah.
It's like this dull, achy pain.
Yeah, for sure. I saw someone recently who was just feeling like numb in one of her thighs. And she was seeing other providers too, and she was like feeling like it was like helpful sometimes, but then it would come back and then it would go away. And she was like, I'm kind of confused why. And it was like definitely a lot of adhesions in the abdomen, which was like preventing, I don't know, the flow of energy, whatever was happening. And we released something and she's like, oh my gosh, should I just pee on the table? And I was like, no. but she just like felt all that.
Just pee on the table.
I know. I was like, what? Are you okay? And she's like, no, did I just pee on your table? And I was like, no, girl.
It would have been okay. She did.
Yeah. I'm fine with that too.
Yeah.
I'm like, if it happens, it happens. She's like, oh my gosh. But it was that feeling of like that sensation coming back. And she was like, oh my gosh, I feel so much better. That numbness went away. And I'm like, it's probably like a dermatome that just got trapped in some of that adhesion. From a scientific point of view, that's what I think. But hey, and then continue with your other providers and do your massage and acupuncture and chiro and all your things that make you feel great. But maybe it was just that internal release that helped,
Yeah.
But she hasn't had it since. So I got a message from her that was like, hey, I feel great.
We love
Go
this.
for it. Yes.
We love these messages.
Yeah, it makes me happy.
Of course. That just makes me think so often about anyone that has had any abdominal surgery, even the exploratory surgery that goes on to diagnose something like endometriosis. Whenever you get anything put into your body is going to try to seal the hole, for lack of a better word, and it does that with scar tissue.
Right.
So I could see that shows up a lot in that picture that you just said.
Yeah, I find a lot of scar tissue. Sometimes it's like a known reason why. They're like, oh, yeah, I realized that happened like during a birth, or, oh, yeah, when I was little, like I sat on my bike real hard and it like definitely hurt my vulva. And, whatever the remedy was at the moment, a nice pack. And I was like at age 12 or something, right? But yeah, that could show up, later in life. Sometimes it's unknown. They're like, I don't know how I got scar tissue there.
Yeah.
That's okay too, you know? Because it is what it is. Basically, when someone comes in, I always tell them, let's treat what we find, and we'll go from there. So it doesn't really have to be a reason that you're coming in like, oh, I had this go on. It's more like, I just want to see what's up.
And because I'm obsessed with fascia has a gliding movement. It should, at least, but scar tissue is stuck in that connective tissue area, and fascia has its own nervous system. There's nerves running through it. It can contract based on your autonomic nervous system, and to throw some scar tissue in there with the trauma that can come up with anything that happens in this world, I could absolutely see how that could impact, like you were saying, even energetic flow. It doesn't have to be a blood vessel. It doesn't have to be a nerve. It could just be that we are energetic beings and things need to move.
Totally. I'm like, sometimes I'll describe it as like a fitted sheet and like say like something got stuck on the fitted sheet, like a piece of gum or something, I don't know. And you remove that, but it's still like crinkled up in that fiber, and you're putting the sheet on and you're like, oh, it's a little more tight on this end. That might be the issue, but this is the irritation. Yes. And so we're like, let's find the driver, like who's irritating this?
Yes.
And that totally happens with fascia all the time.
And that's that pull that you were talking about, right? You're like, I don't know why I'm going over here.
Yeah. And sometimes it's obvious because it's like a cesarean scar tissue. Yes, there's scar tissue. And that could be pulling. And then other times we're like, why is that bound up? I don't know. Let's work on it and see if it helps.
And just always having this utmost respect for the body, that it did what it needed to do in that moment to protect you and to try to carry on function, and not having shame or sadness or, guilt over what your body laid down to protect you, having respect for it, and then sitting with yourself and what comes up, because your body can absolutely release adhesions and scar tissue. That's one of my favorite things to do craniosacral for.
Yeah.
Yeah.
That's awesome.
Breaking it up. My little jangle. I do that with patients, as you know.
Yeah.
Makes me happy.
You're a very animated doctor.
Thank you. I am very animated.
It's great.
This is why I have a podcast.
Yeah.
Because I'm so
and
animated.
The kids love to come see you.
I love the kids. I really do. Another random question that just came to mind, because you've probably seen more vulvas than I've ever seen in my life. I didn't know this until medical school when I started seeing different vulvas and doing pelvic exams, but they can look very different.
Yes.
Yeah.
Right.
Yeah.
There's so many shapes and sizes and like textures and all the things.
Yeah.
You're so right. It's so cool though.
It's so cool.
I thought the same thing too. I was like, yeah, I mean, probably it will all like elbows all look like an elbow, right? Like what's gonna be that different? But yeah, they're totally different. Like even structurally, just like where things are placed.
Mm-hmm.
Yeah.
Yeah.
It's so cool.
Our bodies are amazing.
Yeah.
My friend has this book. I don't know the name of the book, but it shows different structures of vulvas and different structures of penises, and it shows energetically what they are connected to.
No way.
Yes, it's
I would
so
love
cool.
to see that book.
I will find the book and I will put it on the podcast, and I'm also going to send it to you.
That's so cool.
Yeah. And I've only met one other person who has the exact same vulva as me.
What? What?
I know. It's so funny. I couldn't believe it. She came over. We were going in the sauna. I love my body. We were both naked, getting ready to go in the sauna. I've also never met someone that physically looks so much like me. Energetically, we are so aligned. And then I looked at her and I'm like, we have the same vulva. And then she's the one that told me about this book.
Oh my gosh.
Yeah. And for me, it was just so clear that it's related to similarities because I felt like I was looking at myself in so many different ways. And then that showed up.
Wow.
I don't know. Something to it.
So super cool.
Yeah. It's like a zodiac sign for a vulva.
You know, like in India, the face readers?
Yeah.
They're like, I'm the vulva reader now.
You know, you could add this to your repertoire.
Yeah.
Yeah.
Show me your vulva and let's find out who your future, what will happen in your future.
Exactly. There's honestly something to that.
I see a lot of riches in your future based on this vulva.
Exactly. That's what mine says.
It's amazing.
So funny. Wow. The human body, just fascinating.
Mm-hmm.
It really is.
Agreed.
So we talked a lot about, of course, your work and how that you help support the muscles and the connective tissue and the emotions behind it. I am curious if anyone that has endured sexual trauma has come to you to work on that and how they felt in that situation or what came up in that situation.
Yeah, from time to time, usually in my practice, what I've seen is someone's coming with like a pain problem or more of that issue that it goes hand in hand with the trauma. Mm-hmm. So not really have I seen anyone that's purely like, I'm here due to a sexual trauma. It usually goes hand in hand with something else that's going on. Mm-hmm. And I mean, yeah, it's like a lot of, okay, I want this person to feel safe and comfortable, and how can I make you feel safe and let me know, and me like looking at their face. So masks really threw me because I couldn't see what was going on behind the mask. Mm-hmm. And I was like, I can't do this here. Like I can't practice like this. Mm-hmm. I can't like see how if they're like connected with me or disconnected or disassociating with this work. It's not helpful. Like we have to lose the mask so I could just like see the face.
Yeah.
But yeah, things come up in like all sorts of ways. Like some people feel like they'll actually like feel sad. And then sometimes they're like, I'm excited for a new leaf, or I feel happy that I was able to resolve something. So definitely emotions come up that way. But then again, I haven't worked on like someone purely just for a sexual trauma that they're going through.
Mm-hmm. I'm happy that you also brought up dissociation because I don't think that people are aware of how often this is happening. I don't think I was aware of how often I was dissociating until my therapist was like, where do you go? I was like, oh, I don't know. I just leave sometimes. And for some people, this may come up in sex all the time. And you dissociate, you leave your body. Mm-hmm. It's almost like, just let them finish. Then we'll be done. Then we'll be done. I could go to sleep. Yeah. But your body is still not wanting to be there. It's still tucking its tail, as you said. So the body will still remember. So even something like that can be perceived as a trauma by the body in allowing someone access to your body when you didn't actually want to provide that access.
Right. Mm-hmm. Well, that disassociation too, it's like the signs that are there. It's like, do you feel comfortable even continuing this work right now? It's okay. Mm-hmm. Let's like have a clear communication though, because if it's not feeling right, then we shouldn't continue it this way, or we can do something different, or whatever the case is. But we need to like have that mutual consent, right? You could say yes, but be disassociated. Mm-hmm. That's not appropriate.
Yeah, we need to be in the body to feel, to heal it.
Yeah, and there's that like fine level of like, am I in tune or am I out of tune, or where's my balance? Like, I don't want to like definitely perseverate on like some feeling, but I want to be able to globally see what's going on, right? Mm-hmm.
Yeah. Yes, this makes me think a little bit too, just because I'm a neurology nerd, and we talked a little bit about how the pelvic floor is connected to the throat and whatnot. And did you know that the vagus nerve kisses the cervix?
Oh,
isn't that incredible?
That's interesting.
So Sometimes I recommend to my babes before they get a pap smear, if that's something that they hate, to hum or to do a vagal nerve exercise before, just to calm and relax. So I'm wondering in that situation if that's something that could be helpful.
Totally.
And even, your tuning forks are doing this in a way, activating that frequency.
Now that you brought it up,
Yeah.
like, there's people that are like, I'm just going to vocalize or hum a little. I'm like, sure, do your thing.
Cool.
So, I mean, I knew it's like a vagal thing, but I didn't know how close it was there. I mean, we're all connected. I didn't think much of it, but now that you're saying that, it was just because that's what we were working on. And they're like, I'm just going to vocal. I'm like, sure, go for it. Like, you could do whatever you feel right in your session, right? And they'll just be like,
Yes.
yeah.
Intuitively.
Nice, yeah.
Yeah, they were just guided
Really
there.
intuitive.
Amazing.
That's
So-
awesome. Well, I'll bring it up more often too. I'll be like, if you feel like it,
Yes. Yeah.
feel free to express.
Yeah, hum it out, girlfriend. So, because this gorgeous picture is for my viewers, I'm wondering if you could just do a brief little walk through the pelvic floor for someone that's like, what is that?
Yeah.
Yeah.
So this would be your tailbone here. And it is connected to this muscle, the bulbar cavernosus. And this muscle is a sphincter. It closes and opens the holes. So it'll be the urethra, vagina, and then the anus right here. And that will close and open. And you could do that automatically, or your body does it for you. You could control it. And then there's a second layer, which is really like an interdigitizer. And the third layer, this layer is the lifters. So they lift and lower the pelvic floor. So that's why when I don't love the Kegel, because it was just that pressure of that one muscle, the bulbar cavernosus. Really, we need to get into play the third layer also, which is the levators, because they need to lift and lower all the viscera with that movement of the bulbar cavernosus. So again, tailbone's here, and then it goes like into the hips. The famous one, piriformis, like a lot of people know the figure 4 stretch. That's in the third layer of the pelvic floor. It plays into it. And then it connects up at the pubis here.
Incredible. Something random that just came to mind is that oftentimes when I'm releasing someone's ethmoid bone, for those of you that don't know it, it's up here, I can feel, or they will tell me that they feel their pubic bone releasing.
Oh my gosh.
So I wonder if they're related too.
I'm sure they're related.
Yeah. This
Glad you say
body.
That's super cool.
Yeah. My patients teach me things all the time.
Yeah.
I'm sure
me
yours do too.
All
Yeah.
the time.
Yeah.
I always learn new things. And I'm like, huh,
Yeah.
well, that makes sense. That happened a couple sessions ago with someone else too. You know?
Yeah.
Yeah. But I love that. That's like, I feel like what makes me too is like I'm learning all the time. And like, I don't want to be stuck in that role of a physical therapist that just does like, I only want to look at the muscles and see how they're functioning. Like, yes, that's a great foundation that we have. But like, I'm learning from so many different people, like the ins and outs of like energy and how things are all related and all the other stuff providers that have different like points of view. And I'm like, we could just like take this as is. Like, you don't have to just be like, and the obturator internist, that's your stuck one, and I'm just gonna work on that, you know? So
Yeah.
I like
Everyone's
that.
unique. And
Totally.
I think that that's really important to remember as a provider, is that we don't know everything. I remember graduating medical school astounded that me and my friends were doctors. Being like, are you sure we learned everything? But they weren't kidding when they said the real learning happens when you're with patients, because they teach you so much. Every body is different. Every single one is different. And it's important to listen to that person's experience so that we can learn what their body needs, and also trusting their body above anything that we learned in a textbook.
Yeah, totally. I
Mm-hmm.
agree. Even, yeah, I think there's a great like base learning for everything, but at the end of the day, I mean, it's the people. It's the people, it's the humans, right?
Mm-hmm.
Yeah.
Yeah. Well, Theresa, I have loved this conversation. I know that my listeners are going to learn so much from this, and I'm going to put your info in the notes for this so that people can reach out to you if they're looking for a pelvic floor therapist.
Thank you.
Of course. But before we finish off this conversation, I would love for you to share something with my listeners, whether it is a truth bomb, a knowledge bomb, a love bomb, anything that is on the surface of your heart that you want to share.
Okay. Well, I definitely love and appreciate all the other practitioners like you that bring my profession like to light and talk about it and let us experience and like work with your patients. Like they come from you guys, you know, that's how I get my referrals. Like I get it from you guys. You're with people for the ins and outs and you see them all through like their life things. And I'm like in the little pelvis here in my little room doing my thing. So without you guys, I think like we would just be behind closed doors and no one would know about pelvic floor PT. So I appreciate you and people like you.
Oh, I so appreciate that. And truly, that feeling goes both ways because your work is something that I'm very unfamiliar with, and I'm aware firsthand and from my patients how powerful it is and how it really does bring everything together. And I think that even being a functional medicine doctor, a holistic naturopathic doctor, I can't do everything and no doctor is supposed to. We need a team, we need a community of people that we know and trust and refer to and things that we've also tried and found benefits from. So I am forever grateful for you and for your desire to be on this path and for all the lives that you've changed.
Oh, thank you.
You're welcome. And also for being open to talk about this stuff because, you know, not many people are open to talk about their pelvic floor.
Yeah, totally.
But it's your world.
It's my world. I love it. Bring it up at parties.
Yes. Yes. My kind of party.
Yeah.
Yes.
So it's exciting for me, for sure. It's definitely what lights me up. You know, like I have children, but I always say like my first baby was like learning how to practice like me. And that's like my love and the way that I balance my life of being a mom and a partner. And it's just like, I need this in my life. So even if I had $1 million, billion, gajillion dollars, I would still be a pelvic floor PT working on pelvises. I mean, I might be vacationing more, but I might have a yacht, but I would still be doing this because it's just like what lights me up, what makes me feel good.
Mm-hmm. And you could tell.
Thank you.
Yes, of course. Well, thank you so much again. We're going to need you back on to talk about all the questions that my viewers are going to have about all of this fun. And thank you all so much for tuning in. We love you. Mwah.